Hello, everyone. Thank you for joining us today. My name is Sarah Hunstead. I am a paediatric nurse, mum of two, and founder of CPR Kids. And today we are talking about worms and other parasites in babies and children. I am joined by Dr Deb Levy, who is a specialist holistic paediatrician and all-round fabulous lady. So thank you so much, Deb, for joining us today. Do you want to do a little introduction for those who haven't met you before, and then we'll talk about what we're going to talk about today?
Sure. Thanks so much, Sarah, and hi to everyone. As Sarah mentioned, my name is Dr. Deb, and I am a holistic pediatrician, as well as mum to two young girls. My daughters are 4 and 6 years old. I have a particular interest in nutrition and lifestyle and how it impacts on children's health and wellness. So I incorporate 5 elements of this, both to treat conditions as well as to optimize health and development. Sarah and I have known each other for many years, having worked together in the hospital system. Yes. I've worked in pediatric emergency. I'm dual trained in general and pediatric emergency medicine. And it's always so wonderful to chat with you, Sarah. So thank you for asking me to do this.
Oh, no, my pleasure. And this is a subject that is particularly close to my heart, or perhaps my bottom, because this is something that has frequented our house quite a bit. And I actually took my child to see Deb, who actually helped diagnose that she was basically overrun by these little parasites. And a lot of the signs and symptoms, I knew in the back of my head that it could possibly be this, but I didn't realise how a worm infestation as such could actually impact on so many more areas rather than just an itchy bottom. And so this is something that Deb will go through today, and also about other parasites that can actually affect your child. So what I'll do is Deb has got some great visual graphics to help us work through our talk today. So I'm going to bring them up on my screen just now. So bear with me while I actually just fiddle with the technology for just a second, and we will get into this. But before we go any further, what I would love you to do is just to make sure that you can hear and see us well. And remember, we will be posting this to our pages afterwards as well, so you can watch it at your leisure if you can't tune in either live today. Make sure that you ask questions as we go, and please give me a thumbs up or a wave just in the comments below, just so we know that everything is working well. So Deb, would you like to start? Introduce the topic of what we're doing today.
Okay, sure. So this is the third of 4 topics that we're chatting about, which I've called tummy troubles. We've already spoken about constipation, diarrhea. Today is worms and other parasites, as you can see, and next week is going to be on the gut microbiome. Okay.
I cannot wait for that one. That I tell you what, I am really, really excited about.
Yeah, and anyone who knows me knows how passionate I am about that too. But
I do.
All things that are gut, and all things poop, strangely enough.
Okay, yeah, well,
that's what we need. Yeah, great, exactly. Sorry, Sarah, I just wanted to point out the picture of the little boy on the front page of the presentation.
Sure, I'll go back to that.
I'm not going to imitate it because it would be a bit unpleasant for everyone. But essentially, it's just the picture of the finger up the nose, and I chose it for a reason. It's not just to be a bit funny, and I just wanted to point that out to you. And I'll carry on now. Sorry, thanks, Sarah.
Okay, no worries. So remember, fingers up noses.
Yeah, fingers up the nose. Yep. Although probably if any of you follow me on Instagram, you know the answer already. Okay. So what we're going to talk about today are what worms and parasites affect our children, how they get them, when to suspect them. So in other words, what symptoms they can cause, and then what to do about them.
Absolutely.
So I've basically divided parasites. So let me just quickly take a step back. A parasite essentially is an organism or a creature that requires another in order to survive. Okay. And I've divided it into worms and protozoa. I'm not going to get too clinical, and you can see, I mean, if you look down both of those lists, it's very scientific. They're all these long words, and I'm just going to pick out a few that I think are much more clinically relevant. And I'll then go on after this to talk about management in general, and then we'll talk about a few specific ones that, as I've said, are much more common. So just looking at the worms firstly, I've put at the top, number one, the most common in children, and I suspect a lot of listeners today, as well as I know this mum has had children, and there you go, and that mum has had children with pinworm, also known as threadworm, or the proper scientific word is Enterobius vermicularis. And that's all I'm going to say, because I'm actually going to talk about it quite a lot later. So I'll move on. There's tapeworm as well, which is, that classic long-looking one, Ascariasis, Anisakis, that's herringworm, and that's the one that everyone worries about with sushi. So I popped it in there because I know that there's been a bit of media around it, not so recently, but a couple of months ago, about people and kids getting worms from sushi. My kids happen to love sushi, and I let them have it once a week. Yeah, I mean, look, I'm not going to touch on the mercury and all those things now, but just in terms of the worms, I guess I just wanted to reassure families twofold. One, if you're going to a decent sushi place, when they actually cut the fish, they look for it and they're trained to look for worms. So already then you're managing to exclude the possibility or minimize the risk. And also freezing will kill them. And then thirdly, if your child does happen to get them, it's usually a self-limiting condition. It can cause an acute illness, almost like a gastro type symptom, but then it's self-limiting. So unlikely to get it, and if your child gets it, unlikely to have serious consequences. Okay. There's hookworm, whipworm, strongyloides. I mean, all of these different things that, we're not going to go into every single worm. Would be here for weeks.
Yeah, absolutely.
In terms of protozoa, so a protozoa, instead of being an actual worm, is actually just a single cell organism. So very, very, very small, almost impossible to see. So that the most common ones that you may have heard of are Dientamoeba, Blastocystis, Giardia, and then toxoplasmosis. During pregnancy, that's what you're worried about. And then malaria, which thankfully in Australia, is not that common.
Yeah, absolutely. I think Giardia is certainly something, particularly in Sydney, in the water, that has often come up quite a few times as well. So I think that's something that people will definitely recognise.
Exactly.
Okay. All right.
Okay, so the big question is, how do our kids get it? And the main way for children to get any of these parasites is what we call the fecal-oral route. And that means, Sarah's nodding, that means that it's not necessarily your mouth coming into contact with poop, which is really what that sounds like. It's often children, as you can see in that picture, in the mud, in the soil, touching things, playing with animals, on whether that be wild animals or even domesticated animals, and those parasites can then come into contact with their hands, and then the child either rubs their face, eats something, sticks their finger up their nose, all of these ways that children can then contaminate themselves and be infected. The other big one is contaminated water, which again is why I chose that photograph. There's certain worms and protozoa that are more common in water, and that can even be from ice blocks. So you have to be careful where you're drinking water, especially when you're traveling. Not so much in Australia, and I guess people at the moment aren't traveling, except for me, who's in cold Canada. Anyway, the other big way is through undercooked or contaminated meat or fish, and usually that would be beef or pork, and as I've already mentioned, with fish, with sushi.
Yeah, absolutely. But, in saying that, we don't want you to not let your children play outside in the dirt. It's really important that they do. This is just how they may, obviously pick this up, but we're not saying don't let your kids do this. They have to. They need to. It's very important.
Absolutely. Let them get dirty. Absolutely.
Yes.
We're saying that. So what can happen if your child does get worms? Well, firstly, nothing. You may not even know it. Yes. And this then becomes tricky if you detect it on a stool sample. So I must say I find that a little bit of a conundrum, and I never know quite what to do. And that often happens with the protozoas. That often happens with things like Dientamoeba fragilis. or even blastocystis, is I'll often have parents come to me with a child who's been tested because a family member had it, but they've got no symptoms. And then you've got to weigh things up. You've got to weigh up, well, what is the risk versus benefit of treatment? And you've also got to delve really, really deep into whether or not they do have some symptoms, because the symptoms can be subtle.
Okay.
Which we'll touch on as I'm going through all these points here. Gastrointestinal tract, that is number one, the most common symptom, and that can be a whole lot of things. It can be pain, abdominal pain, bloating, diarrhea, as well as your classic itchy bottom, which is pinworm, really. It can also cause funny types of poo, which is just giardia, actually, and those are your greasy poos. And it can also cause a change in appetite, either increased or decreased, usually decreased though. Okay. And it also cause, sorry, I keep on thinking of new things. It can also cause, because of that, it can also affect a child's weight gain.
Right. Okay.
Neurological, this is very unusual. And this is certain types of worms that are very rare for children to get. And that's when they can migrate either into muscles and cause muscle pains, or actually into the brain and cause seizures. But again, I don't want parents to focus on this because it's very, very unusual.
Yeah. And so certainly that in my career, I don't think I've ever seen a child with that, in 20 odd years.
Exactly.
So I think, once again, the benefits of playing in the dirt definitely outweigh the risk of getting something terrible like that.
Yeah, absolutely. And, and it's always, you've got to see it in context. If you have a family who've recently come back from, living for years, within Africa, traveling, camping, that's a very different risk profile from someone, living in Sydney or its surrounds. Going on to behavioral changes. So this is what I meant really when I was talking about more subtle symptoms. So it can just literally make your child a little bit cranky and irritable. Sarah's nodding her head.
Oh, yes. I'll tell you a story in a minute when Deb's finished.
And there can be a couple of reasons for it. It can either be because it's just causing them discomfort and they don't know how to express it. It can be causing a degree of inflammation in their body, which can make you feel unwell generally, and again, cranky. It can be impacting on their sleep, or it can be impacting on their nutrient absorption, again, putting them out of balance. So there are a whole lot of different subtleties that can work into that behavioral one, which is why you've got to be a little bit, you've got to have your antennae out thinking of it. Point 5, I've put GUT, and it's not gut, it's genitourinary tract. So not gastrointestinal, it's genitourinary. So what I'm referring to here is the bladder, the vagina, and even up into the uterus in girls, and it's the urethra in boys, but much more common for this to affect girls just because of the anatomy.
Yes.
And I'll explain that a little bit more. I'll probably just touch on it now instead of under the next section. But what I'm meaning here by the anatomy is if you imagine a little worm, living by a bottom and crawling out of a bottom, it's very easy for it to confuse one hole with another. And what happens, and it's also moist and damp, or the conditions that worms like. And so and I'm sorry if this is grossing you up, but what happens is that the worm will then crawl up into the vagina. And can then crawl up actually into the uterus. And in adults, it's even been associated with infertility for this reason. But they can reside there, and it can actually be very, very difficult to treat if they're in that area, because it's difficult for medication to get to them.
Oh, I tell you what, just while we're here, because this is one of the biggest giveaways that certainly with my children, and particularly one of them, that not only would her behaviour change, but exactly that genitourinary stuff. She would wet the bed when she was not wetting the bed anymore. So even at the age of 8, 9, just wetting the bed unexpectedly. She was horrified, but it was just that urgency and vagina pain. And it would be incredibly, she'd wake up screaming in the middle of the night saying, "Mummy, my vagina hurts." We'd pop her in the bath and obviously look, because you need to see whether it's, what's going on, and you could clearly see a worm or two right there, and it caused so much pain for her. Yep. Now, Deb, we've also had a...
Sorry, I'm just going to explain that one a little bit. When you said of the bedwetting, the way that works is that the worm actually crawls into the urethra, which leads to the bladder, and that's why that can happen in boys and girls. Okay. Yep. So carry on.
Interesting. Now, we've actually been asked a question about symptoms. So the question is, can it cause nightmares in sleep?
I can't think of a specific paper to show me the correlation, but I could definitely imagine that it could, and I'll explain to you why. For two reasons. Mm-hmm. One, nightmares and all-night terrors can be more common in iron deficiency, and some worms can cause iron deficiency, or if worms are causing decreased appetite, that can lead to iron deficiency. So that would be one mechanism. And the other mechanism would be that the worms could be causing a level of discomfort and heightened arousal during sleep, which again can cause nightmares. So I could imagine that it would. The other thing that I looked at actually about, and I did quite a big research, a literature research on this, and I couldn't find evidence of it, was teeth grinding. Because I'd always been told that teeth grinding was associated, but I could not find any evidence for that. So just as a little aside there.
Yeah. My daughter certainly, whether it's coincidental or not, but she would do the teeth grinding along as well.
So did mine. And that's why I was like, this has got to be real. But I couldn't find, the strong enough evidence for me to say, yes, it definitely is. So, and I like to, have the science behind me.
That's what we love about you, Deb.
Systemic I've got there, and that's just your general tiredness children can feel, as well as allergic conditions and autoimmune conditions. I know that we're running a little bit short on time, so I'm not going to elaborate. I'm just going to say one or two little things about the fascinating stories that I've read about worms and how they are intricately related to our immune system. And there are a lot of thoughts and hypotheses that we actually need parasites in order to prime our immune system properly, which is part of the hygiene hypothesis. Yes. There are other schools of thought that think that certain parasites can actually tip us over into autoimmune conditions.
Right.
And so it's just a very interesting field, and I just thought I'd mention it because I get a bit geeky sometimes.
No, I love it. I love it.
Okay, so we will cover this, and I'll cover it briefly. It's just not how to diagnose it. So you have to be you have to suspect it. You then have to look for them, and that I'll describe over the page. And then you have to test for them. And testing for them can be very tricky, and I'll also describe it over the page.
Sorry, do you want me to go over the page or not yet?
Yeah, no, that's fine. And then the questions around other tests, and the other tests are around if there are any complications that have developed, or if you think there are any other associated conditions.
Yeah. So when Deb tells you that you need some sticky tape and cling film,
I actually even brought some props because I thought people would believe me.
Yay!
I was actually doing a bit of a reel on this, but then I got sidelined, so I didn't finish it. I'll do it for Instagram.
Oh, good. We want to know what the sticky tape's for, Deb.
Exactly. Okay, so specimen collection. I think this is a really helpful slide for any poop collection you may have to do because it can be messy and it can end in mishap. Okay, so what you'll need, gloves, container, that's the little specimen container in the picture, and some, just some normal cling wrap or clear wrap, whatever you call it. You can either place the clear wrap in the diaper where the poop will go, trying to avoid where the wee will go, or over the toilet seat, again, just at the back where the poop's going to go. So you want it to be stretched and down so that, or the potty, we've never had one in our house, so I'll talk about toilets, so that when your child poops, it's caught in it, you can scoop it up, and then you get the shovel from inside the little specimen jar and you put it in the jar. So
sorry, the reason I'm laughing is because I recall a practical joke that somebody had done at a friend's house by putting it in their toilet. But this is not for practical jokes. It is for practical purposes this time.
Exactly. And if you're looking for parasites, it's 3 poops in the first 3, of 3 consecutive days.
Okay. Wow. It's who knew that this would be so technical, but it's important. And don't just randomly put it in some jar or ice cream container. You need to actually get the proper jar from your doctor or your pathology provider. I think that's very important too.
Yeah. So this is the hunting for pinworm one. This is with the torch. This is with the sticky tape. Look, there are two ways to do it, right? You either use the torch or you use the sticky tape. I think the torch can be a little bit frightening for kids if they wake up while you're doing it, but whatever works for you.
Yeah.
So you need to do it at night or early hours in the morning. So just before they wake up is probably the best time. If you can time it right. The flashlight is about going in there, your child's still asleep, you pull their undies down or their nappy down, whatever they're wearing, and you literally take a flashlight and you look, you put it, their buttock cheeks apart, and you actually look around their anus for worms. That is what you're looking for. And pinworms are tiny little white threads around about up to 2 centimeters in length, so they're small, and there's a possibility that you could see them. What's more likely is that you'll find the eggs, and that is what the sticky tape is for. So what you do is you take a piece of sticky tape and you literally take the sticky bit, like this, and then you put it again in the middle of, when it's your child's still asleep, hold the buttocks apart. You might need a partner to help you with this, and you stick it all around the anus. That's where the poo comes out. And then you need to put this down either onto a slide or onto something that's glass so that you can actually see it. This isn't the best sticky tape because it's a little bit opaque. The best ones are that magic tape or whatever they call the one that's
clear.
Because you're looking for the eggs, and the eggs are teeny, 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 tiny. Okay. So if it's a difficult diagnosis, that can be something that your GP can send off to a lab for you. Let's move on so that I can get to the next one.
And it's a good idea too, just to let your child know what you are doing maybe before you go to sleep, because they may get a big fright in the middle of the night when you're looking at their bottom. Okay? Exactly.
And as you know, I always have a holistic approach to things, looking at nutrition and lifestyle factors with my 5 to Thrive framework. And that's kind of going to depend on every different parasite and worm. So we can't go into every one in detail, but we will talk about, if you want to just move on, Sarah, we will talk about one or two as I go. So with specific treatment, what I'm referring to here is the medications. Those are the medications that you can get over the counter, usually for children who are over 2. And it's either a one-off treatment or a staggered treatment. So you take a dose and then 2 weeks later you take another dose. Again, depending on what worms we think your child has. There are also options with herbs if you're a herbalist, and it's certainly nothing that I'm going to specifically suggest now, but there have been some reports of success with that. Supportive treatment is around the symptoms that your child is having, whether they need help with hydration if they've had bad diarrhea, whether they need their diet addressed if they haven't been eating properly, or they've developed any nutrient deficiencies as a result of the parasites. And that also refers to the nutrients there. And probiotics, I mentioned last week one, and Sarah and I were talking about it, Saccharomyces boulardii, and that has actually shown some success, and I think it was with blastocystis, but please don't quote me on that. But certainly there is a role for some probiotics depending on the parasite that you have. But overall, it's also about supporting the gut, because if you can think about it, if you've had worms or your child has had worms, they've got a degree of gut inflammation. So you want to help that gut heal.
Yep, absolutely. Okay, you sure do. It all comes down to healing that gut, doesn't it?
It does. So pinworm. Okay.
The most popular one.
The most popular one. And this is probably just time-wise where we may have to end, Sarah. I'll let it be up to you. But, I mean, I thought of going through the life cycle because I think it explains it very, very well so that parents understand exactly what's going on with pinworm, mainly because it's just so common. And inevitably your child is going to have a bout of it, or it's going to go through the daycare or the preschool or wherever your child is. Yes. So the life cycle really encourages auto reinfection. And let me just explain what I mean by that. So let's say your child's friend Peter, sorry, Peter has worms. Peter has worms. He scratches his bum. He gets eggs from scratching his bum under his nails.
Mm-hmm.
He then goes and touches a toy. Those eggs then transfer to that toy. Your child then comes along, plays with that toy. They then touch their mouth, stick their finger up their nose, touch, eat something.
There's the finger up the nose.
Exactly, the finger up the nose.
Yeah.
They then ingest those eggs. The eggs then travel to their gut. That egg then hatches into a worm. That worm then matures into an adult female that then travels outside of the gut onto the bottom and lays eggs that make the bum itchy, that the child then scratches. That same child then sucks their hand or touches their bedding. Can you see what I'm saying? I mean, I'm being a little bit repetitive, but I'm just showing you how hard it is with these worms and how unsurprising it is that so many children get them.
Yeah.
The treatment then has to be directed to the child as well as everyone in the family.
Mm-hmm.
And the treatment is not just medical, it's also the environment. And the environment being you have to clean everything. You have to clean bedding, you have to clean toys, you have to wipe down surfaces. You also, in terms of cleaning, like for house dust mite, you can stick it in the freezer, it kills them. You actually have to use hot water. You can't do that with
all the bedding and the towels and everything through that hot wash.
Yeah. Alternatively, I guess you could just put it aside for a couple of weeks.
Okay.
Because the eggs do have a life cycle, and the eggs last probably for about 2 to 3 weeks.
So even outside of the body on a sheet, for example, we're talking 2 to 3 weeks, they're going to survive there. Wow.
They can survive for that long. Yeah.
Goodness.
Which is why there's that interval of treatment. So you try to catch those worms that haven't yet hatched or haven't, you haven't managed to clean them up. So, and then they've reinfected. So that's kind of why. I find though, if children I find sometimes they actually need another course 2 weeks later, but that's not every child.
Okay.
So I think that it's an undertaking, but it's an undertaking that you've got to do thoroughly. Otherwise, you're going to be in the same situation.
Yep, absolutely. Yeah. So one question that we do often get, Deb, is that should we prophylactically be giving our child worm treatments? So what I mean by that is, should we be worming our kids every, month or 3 months or whatever, just in case they've got them? Or should we just wait until they are showing symptoms? Is it okay for them just to live with a little bit and we just don't know?
I do not think we should be treating prophylactically. I never think we should just give medications. And yes, I think that children need to kind of not earn their pills, but, we have to have reason to give things.
Yes, fantastic. Thank you for clarifying that for everyone. That is great. So we are coming up to half an hour now, and we have just touched on the most common thing, which is pinworms. Does anybody have any questions at all before we go any further? Please type them in now while we are on live. Yep, exactly. So Deb, would you like to, is there anything else that you want to talk about before we finish up today, or are you happy to leave it at these pin or thread worms?
I'm just trying to think. I mean, we can flick through the next few slides, but but unless there was anything that you wanted to share in terms of your personal experience with them, Sarah, I think that, I think the bottom line is, and maybe
the bottom line.
I know, fine, right? I think the bottom line is all worms are really common, especially pinworms, and as are parasites. They can be harmless. Mm-hmm. They can cause symptoms. We just have to be aware of them and think of them.
Yep.
And in terms of diagnosing it, we can also look in the poop. I mean, the only reason I spoke more about looking for them was as I was, really focusing on pinworms. But there certainly are some worms that you can see in poop, and even pinworms you can. And then we have to take the correct samples. And the other thing I also wanted to say that there's certain worms and parasites that seem to like to be together, and the classic duo or duet is pinworm and dientamoeba.
Really?
Yeah. And so if you've got one, you should always think of the other. And if you've got one, like the other as well. So that's quite a strong correlation.
Right.
And I'm just trying to think if there's anything else. I mean, I'm just trying to think of the top things that parents, it's about it's the disrupted sleep, it's the behavior, the diet. And I mean, look, there's certain parasites that cause disruption of certain nutrients being absorbed, and we've touched on that with Giardia. And what that does is that causes, quite significant diarrhea, tummy pain, greasy stools, and you often have to think about treating there. The other thing also, sorry, that I wanted to mention is there are certain nutrients, thanks to this one thing I did totally forget to talk about. There are certain nutrients that have been reported to help, zinc being one of them, as well as vitamin A, and that's thought to be also in supporting the immune system. So there's a lot of options out there, but I always think if you're thinking of supplementing, you should know levels. I always feel more confident knowing what levels are. But otherwise, I think, I hope that we've given a good overall understanding of parasites, the most common one being pinworm.
Yeah, I definitely think so. And we've also had quite a few questions come up too. So I think we should, we should answer those. I think would be a good place to end. So what we'll do is I will just pop us.
I still can't see them, by the way, Sarah. I still can't see the questions.
I'll bring them up. I'll have to see. This is the problem. Me driving the technology. This isn't a good thing.
Yeah. It's 8:30 at night here in Toronto.
There we go. So any natural alternatives to Combandrin? So you just touched on that just then. There are lots of different over-the-counter worm treatments available. So obviously speaking to your doctor or pharmacist is an important thing there. But certainly, Deb, how would you like to
Look, I mean, I think there's lots of potential other or natural alternatives. I always think with children, when you're considering giving herbs, you have to do it in a very measured and safe way. I've certainly seen children who've come to see me who, for example, have been given oregano oil, which has really disrupted their gut microbiome, and I certainly think that there's a space for natural options, but I think you just have to be careful. In terms of specifics for worms, I've also read, by the way, coconut oil.
Right. No.
I'm not 100% convinced. But I think that's where I'll leave it in terms of I would rather you see a qualified herbalist or naturopath who's comfortable prescribing pediatric doses as well. And I always, and I often think, go slow, start low kind of approach with these things.
I think that's a very, very sensible approach. And one thing that you said there that really resonated too was somebody who is a pediatric specialist in that area as well. Like you wouldn't take your child to go and see somebody who's a specialist in aged care in general medicine. So why would you do the same for a naturopath as well? You need to have somebody who actually is qualified to be looking after kids. I think that's an important thing. Okay, so another question that we have, Deb, is from Claire. And so Claire is talking about the sushi that you were talking about before. How do you treat these specific worms from eating sushi?
There is medication, or you can just let them pass. And my understanding is they only survive in you for like 2 to 3 weeks. But there is medication, and I would have to look it up in my notes because I can't remember it offhand. Alternatively, I can post that afterwards for you if you'd like.
Yep, that'd be great. Thank you. Excellent. So thank you very much. So Deb, as usual, you have been an absolute fountain of knowledge, being able to talk us through particularly what is a really, really, really common problem, and certainly making us aware of those behavioural things, everything from being cranky and maybe teeth grinding, not sure, to wetting the bed, and that even in girls that, vagina irritation, things that you may not necessarily associate with those most common pin and thread worms, and also being aware too, of course, of the other parasites that love to infect our bodies. Now, as I've been talking, we have had one more question pop up, so let's just quickly do that. Stacey, you snuck in just in time. So Stacey said, what about chronic reinfestation? So Deb, you talked before about repeating the dose 2 weeks afterwards if necessary.
Yeah.
But judging by the look on your face, this is going to take you half an hour to answer this, I think. But
well, I think it's a really, really tough one. And it often requires different medication from what you're used to buying at the pharmacy.
Okay.
I think the message here is finding a practitioner who considers it and who's comfortable diagnosing it.
Okay.
And I'm not sure, Stacey, if you have a boy or a girl, it is more common in girls for the reasons I've described, but it can happen in boys too. But I think that, I mean, there isn't one specific thing. It does happen, and it happens a lot. And it just means that we have to step up treatment. And sometimes that is when we need to also integrate with a herbalist, because sometimes the what we have isn't adequate. But I mean, the one drug that just pops to mind is something called ivermectin. I'm certainly not suggesting it or prescribing it for your child, but these are more unusual medications that are used for parasites.
So I think, Stacey, what's going to be important is that you do get a referral to a paediatrician to be able to investigate this. I think that's going to be very important. Don't go it alone, okay? Seek definitely some medical help. And the questions keep coming, Deb. I'm going to
you would have thought worms.
Yep, I know, worms, exactly. So Fiona has said that she has seen a pinworm. How would she know if they've gone into her uterus? Is convention enough?
Okay, you don't know. Sorry. Except if she has symptoms or not. So if you've seen it once and she's had treatment and she doesn't have any what we call vulvar vaginitis, which is the red inflammation, itching of the vagina, or any urinary symptoms, as Sarah's mentioned, it's very, very unlikely. So I think that's quite reassuring. And I would just say, keep an eye out and have a low threshold for retreating if it reoccurs. The reason I said it was hard to treat is just often because it becomes quite over-infested because it's not thought of with vaginal symptoms.
Yep, absolutely.
Yeah, I don't know. Was that clear, Sarah?
Yes, I think that was very clear. Okay, last one, guys. No more allowed after this, okay? Such a popular subject. Okay, Liz has asked, are there any suggestions for the extreme vagina pain? I've been there at 2 o'clock in the morning with a child screaming with a sore vagina. I understand it can be terrible. What do you suggest, Deb?
You done, Sarah?
What have I done? Bath, warm bath is what we have done.
You just bath with salt or not?
Yes. What we also found as well is that often we would be able to see the worm right there that was causing the pain. And so what I would do was I would just have a face washer and wipe it away, remove the worms, and that would often help a lot. And then because there would be some irritation there, popping into just a warm bath, and that often helped as well. But removing the actual worm itself was often, a really good way of doing that. We did find as well, and I think this may in fact just be a psychological thing. From a very young age, my daughter thought that paw cream fixed everything in the world. So you could put paw cream on for her forehead and that would help make her vagina feel better. I'm exaggerating a little bit there.
Yeah.
A little bit. But certainly for her, what she would want to do, because she always wanted to be involved in her own care, is that she would want to just put a small amount of paw cream on her vagina, and that for her really helped as well. And I don't know if this is true or not, Deb, but one of the ancient nurses that I used to work with in ED, she would always put, when her kids had worms, some of the very sticky paw cream between the anus and the vagina, because the worms, she said, found it harder to migrate.
Yeah.
Yeah. Mm-hmm.
Yeah. I don't know about that, but it sounds reasonable. The other thing I've also read some things about using coconut oil.
Right.
Whether that's because of its properties or the tackiness, I'm not sure. I guess in terms of the extreme vagina pain, Liz, the vinegar bath, yeah, I mean, if it's not stinging her, or a salt bath would be my normal go-to because of the inflammation there. Otherwise, some even oral analgesia, some ice if it's inflamed.
Yeah.
Sorry.
Absolutely. No, I know, it's just fine. It's just going and doing those and trying
different things.
Yeah, absolutely. And we did use cold packs as well. So remember, no ice directly onto the skin, simply a cold pack with a tea towel wrapped around it, and that was often some good relief as well. Yeah, exactly. So hopefully that has helped. Yep. Okay. Excellent. And we've had another person who has said that they've used the coconut oil with excellent effect. So there we go. Yeah. Okay. All right. Well, this has been a fabulous subject to talk about. Who'd have thought that worms would be so wonderful to talk about, Deb? Thank you so much for joining us today, and we will see you all very, very soon. What are we going to talk about next, Deb? What's it going to be?
The gut microbiome.
Oh, of course it is. How could I forget that? So this is the big one.
I don't know how we're going to contain that. We can't even contain worms to 30 minutes.
Yeah, no, we're not. We're just going to talk, okay? So, guys, you can just have the recording and you can watch it at your own leisure, because we're going to talk forever, okay?
All right. And thank you, Sarah.
Thanks, everyone.